You're about to learn something that will completely change how you think about human survival. For most of human history, childbirth wasn't attended by doctors or hospitals or sterilized equipment or any of the medical infrastructure we now consider non negotiable. It just happened. Women gave birth alone or with other women in caves and huts and fields, and somehow the human species survived to make videos about it. So, how did they actually do it? The answer starts with something obvious but worth saying out loud. Your body knows how to do this, not intellectually, the way your brain knows how to solve math problems, but instinctively, the way your body knows how to digest food or fight an infection or heal a cut. Childbirth is something your biology was literally designed to accomplish. For hundreds of thousands of years, women's bodies have been doing this without instructions, without epidurals, without fetal monitors or emergency C-sections or any of the things that keep modern mothers alive, which raises an uncomfortable question. Did it work well? The honest answer is complicated. Here's what we know. Maternal mortality rates in pre-industrial societies were genuinely catastrophic by modern standards. We're talking about somewhere between 1 and 2% of all pregnancies resulting in the death of the mother. That doesn't sound like much until you do the math. A woman who had 6 children had roughly a 5 to 10% chance that pregnancy itself would kill her. Across a lifetime, it was a real and present danger, and that's not even counting infant mortality, which was devastatingly high. But here's the thing that complicates the narrative. Women kept having children anyway, not because they enjoyed it, obviously, but because their bodies actually managed. The majority survived. The majority gave birth successfully without medical intervention. So there must have been mechanisms at work, biological mechanisms, social mechanisms, behavioral mechanisms that made this possible. Let's start with biology. Your body goes through specific changes in preparation for birth, months in advance. Hormones flood your system, softening ligaments in your pelvis, widening the birth canal, preparing your uterus for what's about to happen. When labor begins, your body produces hormones that actually reduce pain perception. This is not something the body does casually. Your brain chemistry literally changes to make the pain bearable. It doesn't eliminate it, but it makes it survivable. And then there's the pushing. When the time comes, you don't think about how to push. You don't need instructions. Your body starts doing it automatically. Contractions happen whether you want them to or not. And most of the time, this works. The baby comes out, the placenta comes out, the bleeding stops. The body knows what to do because it has been doing this for 250,000 years. But biology only gets you part of the way there. The other part was social. In nearly every human culture we have anthropological records of, birth was attended by other women primarily. Midwives weren't necessarily formally trained in the way we think of medical training, but they had experience. They had delivered dozens or hundreds of babies. They knew what normal looked like. They knew when something was wrong. And crucially, they knew what to do in emergencies. That knowledge was transmission in an incredibly harsh way. If a midwife made a mistake, someone died, and next time they didn't make that mistake. This was natural selection operating on medical practice. Over generations, the procedures that worked survived. The ones that didn't killed people until they were abandoned. Some of these practices seem bizarre to us now. Some of them were actually very good. Midwives understood that movement during labor helped. They understood that position mattered. They knew to keep infections from the birth canal. They understood that patience was sometimes better than intervention. Many traditional birth practices that seemed superstitious were actually brilliant adaptations to the constraints of childbirth without modern medicine. Here's a specific example. In many cultures, the umbilical cord was not cut immediately. The child would continue to receive blood from the placenta for minutes after birth. This might seem like it had no purpose, but there's actually a biological benefit. It increases the infant's blood volume, improving oxygen delivery in those critical first moments outside the womb. We now know this is optimal. Cultures that didn't do this had higher rates of anemia and complications in infants. The cultures that did survived better. Were there other practices that were actively harmful? Absolutely. Some cultures applied heat to the abdomen during labor, thinking it would help. Some used tools in ways that caused injury. Some practices were based on complete misunderstandings of physiology. These cultures sometimes had worse outcomes, and eventually, Those practices were abandoned, or the cultures themselves were displaced by ones with better outcomes. The other massive factor was genetic self selection. Let's be direct about this. Women who could not physically deliver babies without modern medical intervention simply did not have children in pre industrial societies. They either didn't get pregnant or they died, and they didn't have descendants. Over thousands of years, this meant that the human population became increasingly composed of people whose bodies were good at giving birth without medical help. Your ancestors survived childbirth without doctors. If they hadn't, you wouldn't exist. This might sound callous, but it's just how evolution works. We have bred ourselves to be capable of this. But, and this is important, we have also massively improved outcomes by developing modern medicine. The reduction in maternal mortality in the past 150 years is not subtle. Modern obstetrics, antibiotics, blood transfusions, surgery, epidurals, fetal monitoring, these things work. They prevent death. A mother in a hospital with access to emergency C-sections has a survival rate that is orders of magnitude better than a mother in a pre-industrial setting. The reason we can say that childbirth without doctors was survivable is precisely because medicine has made it much, much safer. So here's the actual answer to the question. Humans gave birth without doctors because they had to, because the alternative didn't exist. Their bodies were adapted to do it through evolutionary pressure and genetic selection. Their communities had accumulated knowledge about how to manage it. They had pain management through their own biology, and most of the time it worked. It didn't work perfectly. Hundreds of thousands of women died. Babies died. There was suffering, but there was also survival. And through that survival, modern humans were born into a world where we could eventually develop medicine that made the process exponentially safer. Your body probably still contains all the machinery for childbirth without medical assistance. You're just incredibly unlikely to ever need to use it that way, because unlike every human before you, you have a choice. And that choice exists because of medical knowledge built on understanding how humans succeeded without it. That's the real story of childbirth before doctors. Not that it was easy, not that it was ideal, but that humans were stubborn enough and adaptable enough and biologically driven enough to do something genuinely difficult without external help. And that drive is literally why you exist.